We really look at it today that misaligned incentives are the real challenge. And so, what I'm really the most excited about is how do we realign incentives? Align incentives is the new AI in healthcare.
Welcome to A Swift View on Health. My name is Scott Schoenvogel, and I'm here with my partner, Wally Gomaa. And today, Wally, we're going to talk about you. So let's just start from the beginning, Wally. Let us know a little bit about how you got into the healthcare industry to begin with, and then ultimately, became the president of Great West.
I started my first job as an accountant in the Houston Medical Center with a healthcare system. And it was really that exposure that gave me the taste for the business of healthcare. I really felt like I was on the path to be a hospital administrator. I went to graduate school and was really trying to head down that road. And I was really in the middle of the 1990s when managed care was the cool new thing. And so I got a taste for moving into the HMO world. And took a position from there with Great West Healthcare, helping to expand and launch their HMO plans around the region, around the country, which was, a really exciting ride. But, it was that contrast of being on the provider side, where we're focused on increasing volume, to going to the health insurance side, where we're trying to reduce volume and utilization, that kind of gave me a really nice perspective on the business and sort of the tug of war in healthcare.
So Wally, that kind of perspective, in terms of being on two different sides of the industry. I know after you left Great West, you did that all over again. You moved from being on the insurance side to actually becoming a broker consultant and representing employers. When you made that transition, like how'd your perspective change there?
Yeah, I really kind of left a little arrogant from my role as president of health plan operations at Great West to coming into the broker side. I'm going to show these brokers how insurance is really done. And I was quickly humbled. A couple of months in, I called my wife on the way home. I told her I'd made a horrible mistake. I'm in way over my head. And I just really underappreciated how challenging it is to be a benefit consultant and the many things that you need to know in order to set strategies for employers that are really counting on you, to control healthcare inflation, to engage their employees. I mean, it's a much larger role than I ever understood or appreciated. I like to say that's where I really learned the industry. When you think about not just how does this impact your hospital, how does this impact your insurance company, but how does this impact the employer and their employees, the patient, the individuals we're all here to serve? And that's just where you realize that the weight you carry as a benefit consultant, it's a pretty big deal. Now, what I really enjoyed is I had the opportunity to be an advisor to employers, but under the same umbrella to actually launch some healthcare companies that were really designed to equip employers, to reduce costs, to improve clinical results, and ultimately to extend the quantity and quality of people's lives. And so that was just a great experience of 19 years on that side.
So, Wally, let's talk a little bit more about that work that you were doing at ACAP Health. ACAP Health, and that was not traditional benefit consulting. Obviously, even though that benefit consulting was extremely challenging, I think you did figure it out. You were building a very large client list. And so why move and start building a whole new platform like ACAP Health?
Our real motivation was that we needed to solve the challenges facing the industry. And during that time, our belief was that the greatest enemy in healthcare was disease. And that if we weren't doing something meaningful to reduce and reverse, the burden of disease on the population, that we were never going to be able to solve the industry challenges. A lot of our work was really around the metabolic syndrome category of disease. And we were fortunate to have ultimately launched a national business and solution that was designed to reverse metabolic syndrome, recognizing that for the majority of healthcare spend impacting plan sponsors, most of that is coming from individuals that have three of the five metabolic risk factors, present in their biometrics. And we had a solution that we were able to deploy on a national scale, and really help to reverse that trend. And it really was extending the quantity and quality of people's lives. What ACAP was really designed around was recognizing that as a brokerage agency, it's too important just to keep it to yourself and to keep it to your own clients. So ACAP really was working, to expand that with other brokers and consultants, ultimately equipping the insurance carriers themselves in order to adopt these solutions. And that's really, Scott, where you and I met. We ended up moving beyond that work to becoming, a distributor for Compass, the business that you started, and that created a great journey of dealing with utilization around disease burden on one side, but also controlling price inflation through the work that you launched and led at Compass. So we really liked the combination of those solutions, and that led to us supporting and launching other businesses as well.
So Wally, you would think that would be enough, right? We're leading insurance, we've become a benefit consultant, we're building a whole new platform to, bring the best solutions, to the industry. Yet, alternative health plans was really your vision. And in fact, I think you even came up with the name. Like, what inspired you to now want to go down a completely new track and create an alternative health plan?
Our vision was always around leave the campground a little cleaner than when you got there. And even though we had done, I think some really meaningful and important work on, reversing disease burden, on dealing with unit cost and price inflation, we still had a disconnect in how our insurance model aligns around high quality care. And, it had been about 2 decades since there had been anything innovative done in plan design from when high deductible health plans rolled out. So it was really exciting around the business that was SimplePay, and then after we sold it to Blue, became Coop Health. To really bring forward a new plan design and payment model, that ultimately moved the industry forward at dealing with cost and quality challenges. So that was exciting work, and I think we can look back now that we've kind of finished our co-founding, exit on that business, and look at that with some pride that we did something meaningful that's going to continue to build, I know, for many years to come.
Okay, well, all that's been an amazing journey and just incredible perspective on all sides of the industry. And yet, here we find ourselves on yet another adventure at Swift Health. So, talk to me a little bit about, kind of your view on Swift and just kind of the passion you have for what's next.
Well, I can say this probably for both of us after, having started between the two of us a number of different companies that we scaled and we had exits on that were successful. Our goal at this stage is not to go build another business, but to actually find, opportunities in the industry and to be in the equipping game. We want to equip organizations around opportunities that can continue to transform healthcare and help those organizations move more swiftly, help innovation move more swiftly, which is just, a ton of fun, right? We're not having to necessarily do a lot of the building and the operating, but we're now doing more of the equipping and again, creating more swift speed towards real answers, that are needed in healthcare. I in some ways look at where we are as a return back to the future, if you will, of the 90s. We have a season right now that we're in the middle of, some of the highest healthcare insurance trends. The access challenges continue to be meaningful, they're real. And we don't like to point fingers and say that the enemy in healthcare is providers or insurance companies or big pharma, we really look at it today that misaligned incentives are the real challenge. And so, what I'm really the most excited about is how do we realign incentives? Align incentives is the new AI in healthcare. How do we align incentives in order to create a better answer? The only time in healthcare that we were ever in a period of deflation was in the 90s when incentives were largely aligned. And so I think a lot of the work that we're going to be hoping to bring forward is going to be able to realign incentives so that patients can get high quality care on a timely basis, and we can extend our mission of extending the quantity and quality of people's lives. That's what it's all about.
Wally, thank you so much for sharing your journey, your story today. It's been incredible. And thank all of you for watching this episode of A Swift View on Health. Stay cool and stay swift.